Gillian, the Care Minister. Good morning.
Good morning.
So first of all then, on the reduction of isolation, the UK Health Security Agency says its analysis suggests a 7-day isolation period plus 2 negative lateral flow tests has nearly the same protective effect as a 10-day isolation period without testing. How big a risk are we taking with this reduction?
Well, they basically said, there's sort of constant analysis of data, but the most recent analysis has shown that serial testing is, an equivalent risk is the words that they were using. So, they've looked at this very carefully. They're constantly analysing it. And I think it's good news that they've come forward and said that this is a more pragmatic approach, but potentially to make sure that people can still go about their daily business and go about their work.
Does this apply to people who are, even right now, listening to this, who are part way through isolation? Who does this apply to?
Yes, it does. So if you work it out, if you were confirmed as positive or you first showed symptoms on Saturday, the 18th, then now you'll be able to take, assuming you get a negative lateral flow test on day 6 and day 7, you'll be able to enjoy your Christmas lunch.
Wow, okay. So it's all about kind of getting people back out and about in time for Christmas, really. That must be one of the motivations here.
No, it's about a balanced and proportionate approach all the time, and looking at what works really, and whether we can use testing efficiently. We're one of the world's largest consumers now of tests. So we bought a lot of tests to make sure that we can use testing as a key part of our armoury, really. It's a key tool to enable us to take that balanced risk. Same for contacts now. Previously people had to stay at home if they'd been in contact with someone. Now they can take daily tests, and as long as they're negative every day, they can continue to go about. So effectively, we're using testing a lot more extensively.
Okay. Already on our programme this morning, we've been discussing difficulties facing various sectors. We were chatting about rail earlier, also hospitality, the number of people who are off as a result of either testing positive or indeed having to isolate because they're connected with someone who's tested positive. Just with your brief, I wonder if you can tell us how difficult the situation is in care homes at the moment. It's staff shortages, which clearly were already a problem. Is that being exacerbated by things like people having to isolate?
Yes, I mean, as you say, it was already a problem. We had already, I think, 105,000 vacancies. So obviously, if you've got people isolating because they're positive, then that obviously is more disruptive. So I'm sure they'll welcome this change in approach as well. But we've also very recently sent more money to the front line, actually, in total £462.5 million to enable those working in the care sector and local authorities to basically make sure that they've got the right staffing in place, and they can bring in agency staff, they can pay overtime and retention bonuses, which is an issue in the sector. So we hope that that money's just gone out, actually, so we hope that will help in this current challenge.
I noted that in Glasgow, teachers are being called in over the Christmas break to try to alleviate staff shortages in Glasgow's care homes. Is there that level of intensity in England's care homes? Are you going to need to call in reinforcements at some stage over Christmas?
Well, every local area has local resilience forums, and they are basically run in conjunction with the local authorities and lots of public servants in the area. And they have contingency plans. We have lots of different step-down contingency plans all across the country to be able to be more flexible about staff, be more flexible about various staff doing various roles if required. But we at the moment, as far as I'm aware, haven't introduced the same arrangements that they've put in place in Glasgow.
Oh, understood. So the situation not quite as intense, perhaps. I want to discuss Christmas and indeed post-Christmas. I wonder if you are in some ways envious of the clarity that's being offered by leaders in Scotland and Wales, Nicola Sturgeon and Mark Drakeford, who are setting out their plans for post-Christmas already, while Boris Johnson seems so intent on delivering good news that he can't quite bring himself to tell us what 2022 is actually going to look like.
Well, of course, he doesn't have the data yet in the future. And what we're trying to do is to, look at the data as we get it, analyse the data. We have 2 or 3 meetings a day where we all, look at this data and look at the risks. And, if we won't hesitate. We've said that we will not hesitate if we need to. But what we still are waiting for, more data. There's a lot of uncertainty in the data. So we're waiting to to get more certainty on that. And we've said, look, up till Christmas, but we will reserve the right. And we're used to having to change our plans quickly with coronavirus. It's not ideal, but we really do want to see what happens with this new variant and how severe it is, and lots of other factors, which until we get that data, we won't know.
I'm intrigued that he doesn't have the data when Nicola Sturgeon and Mark Drakeford clearly do. Is this actually about his own political judgment and that he doesn't want to do anything with the data that all the leaders are seeing?
No, they have the same data, but they don't have data. Which
so why are they behaving? So why are they able to make decisions based on the same data and Boris Johnson isn't?
Well, we are making decisions. We're making decisions to keep the situation we've put in place, put the new rules that we've put in place today with isolation, and every day the data comes through. We'll if we see large jumps in the data, large jumps in hospitalisation, we see the severity and we get more confirmation on that, then of course we'll react. But we don't actually have that yet. So what they're doing is obviously taking a balanced approach in some ways, but they're looking at the risk and they're coming up with a different answer. But we've
so
said
it is a political judgment.
Review. No, it's not. No, it's based purely on the data. If we don't know the severity yet, what we don't want to say is, look, everything will be as whatever rules they come up with, just because we don't know the severity of the disease yet. So I think we're taking a better approach personally. But of course, the devolved administrations, everybody looks at their risk. Everybody will take their own opinions. They have done all along, to be honest. I don't think there's anything changed. They've had different rules at various times. At various opportunities. But, we look at the data and I think we've got a sensible, balanced and proportionate approach in place, which again gets the balance of trying to not let coronavirus run everybody's life and try to get that balanced approach. But people do have to also be cautious, and we have to watch the data. We're meeting all over Christmas. We'll be meeting, a couple of times a day, looking at the data. And if we need to act, we will.
Gillian Keegan, Care Minister, thank you very much indeed for joining us. Thank you.